in the June 5th, 1981 issue of CDC's Morbidity and Mortality Weekly Report was an article that would change medicine and change life for all of us. Doctors from 3 Los Angeles area hospitals reported 5 unusual cases. The patients had diseases such as Pneumocystis pneumonia, active cytomegalovirus infection, oral candidiasis. These are all unusual diseases for healthy people. This article was read by physicians across the country, and some of those physicians began to recognize that they had patients very much like these described. News made it to print media and television news, and ultimately, what we now know as the pre-AIDS era had come to a close. While AIDS had already occurred in people in the United States, in Haiti, in Africa, this article really was the first that presented it in the fashion of something new, that this disease, the conditions, the patients in this article represented a challenge to the medical community, something that the authors thought would be more common in the future. And sadly, of course, that was very true. So who were these individuals? Who were these patients? Well, we know they had several things in common. They were all young men. All 5 of them were under 40 years old and averaged about 32 years. We know that they were all previously healthy. They all identified as gay, and some of them admitted to having frequent and recent contacts. Well, what do we know about their conditions? What did the doctors find? The article is titled Pneumocystis Pneumonia Los Angeles. So these 5 individuals, of course, all had pneumocystis pneumonia. Now, what is this? This is due to the infection by an organism which at that point was called Pneumocystis carinii, which is now referred to as Pneumocystis jirovecii. This is a very unusual form of pneumonia. It is seen in individuals that have suppressed immune systems for one reason or another. But in healthy individuals, this is just not seen. So it's a very unusual type of pneumonia. This infection is treated with several drugs. The first is a combination, trimethoprim, sulfamethoxazole, and a second, pentamidine. Pentamidine isothianate is rarely used and was only controlled by the CDC at that time. And so the parasite division of the CDC began to recognize a strong and sudden demand for this drug, pentamidine. And that was one of the indicators that something new was going on. So all patients had this unusual pneumocystis pneumonia. Additionally, they all had active or very recently active cytomegalovirus infections. Cytomegalovirus infection is very common. Many people watching this video will be infected with cytomegalovirus. But healthy individuals, people with a strong immune system, will keep this virus in check. These patients had cytomegalovirus that could be found in their blood, it could be found in their urine, and it was found in one patient in the lungs. So they all had this active CMV infection. The physicians also noticed that these individuals, or many of them, had mucosal candidiasis. This is a fungal infection. Candida is a genus of yeast. So this is a yeast infection of mucosal linings. And these yeast exist in our mouths and so forth. But again, with a strong immune system, we are able to keep them in check. So what did these physicians think? Well, clearly they thought something new was going on. That's why this paper is really seen as the first one that defines the AIDS era. There were other articles previously that described individuals that very most likely had AIDS, but this is one that began to tie things together and suggest that there was some new disease out there that the medical community should be on alert for. What it was, they weren't quite sure. They certainly recognized or certainly hypothesized that these individuals had a fairly severe immune suppression. Of 3 of the patients tested for the ability to respond to certain antigens and mitogens, all 3 effectively failed the test. So they had a good idea that there was some immune suppression going on, but they weren't exactly sure what caused it. Was it something infectious? Was it something environmental? Could it be certain practices? What could it be? All 5 of the patients admitted to using an inhalant drug, alkyl nitrates. Could this possibly be the cause of all this? They weren't sure, probably didn't seem likely to them, but they certainly had to suggest it. Another possibility was cytomegalovirus. All these individuals had active cytomegalovirus infection, or at least that cytomegalovirus infection was documented to be active 5 months previous. They also reference in their paper an additional study that demonstrates that cytomegalovirus infection, active infection, can be tied to a temporary suppression of the immune system. It certainly seemed like they had more than a temporary suppression of the immune system. Indeed, 2 of the patients had died already, and the others remained weak. So again, it seemed unlikely, but they had to propose the idea that cytomegalovirus might be involved. But certainly in their paper, they make no firm conclusions. They are putting forth ideas. They are creating awareness of something new and suggesting to the community these might be things that will be looked at. Indeed, the alkyl nitrates were eventually looked at and quickly ruled out as a cause. Cytomegalovirus also quickly ruled out as a cause of the disease. So what do we ultimately have in this historical paper? We have documentation of 5 patients, all suffering symptoms of a severe immune suppression. They have several things in common, but there is no clear sign that points to any one type of cause, or even several that might be really good candidates. So this is the beginning of a mystery that would ultimately take on an enormous effort, a moonshot scale project. It would result in the characterization of the disease. It would result in the isolation of a novel virus. It would result in the production of antiviral drugs. It would result in the production of a blood test. It would also change the way physicians practice. It would change the way food service practiced. It would change in the short term very much how we interacted with each other in the public, as the fear of this new disease, which seemed to be 100% lethal, began to take over the airways and water cooler discussions. And next, we'll be looking at an additional paper by Dr. Henry Masur, in which he describes in the New England Journal of Medicine the nature of this disease at a fundamental level, that it is a disease that is characterized by a suppression of the cellular immune system. Indeed, we can see the suggestion that the cellular immune system is being disabled here. We have infections such as candidiasis. We have reactivation of cytomegalovirus. These are all types of infections that are controlled very well by the cellular immune response. And so the appearance of these diseases in individuals strongly suggests that there is indeed a suppression of the cellular immune system, and that indeed will be demonstrated shortly after the release of this paper. So I hope you enjoyed this historical look back at the beginning of the AIDS era and found it valuable in looking at the emergence of new diseases. Thank you very much.